The aim of these exercises is to teach your body to use your muscles so that they automatically ensure torso stabilization and the correct alignment of individual body parts relative to each other, not only while static, such as while standing and sitting, but also during movement. This will help you with pain and act as prevention from overload or injury to the musculoskeletal system. If you want to change your movement habits, you must start by learning to perform exercises correctly. Take regular exercise as training for your body and mind. Initially, exercise is more demanding. You have to think about everything a lot. Gradually, the movements will become more automatic, and it's time to move on to the next level. Increase your load. Gradually, you will be able to perform more challenging exercises, which need to be done on a daily basis. Already from the beginning, you may notice positive effects such as pain relief, improved mobility, and a more upright posture. Before you start with each position, you must understand the basic principles that will apply to all exercises. Your first task will be to settle the pelvis, chest, head, and spine in the correct position where they will be built like 3 interconnected blocks on top of each other. With this structure set up, you are able to achieve the best quality of balanced engagement from all torso muscles, including the diaphragm and pelvic floor. For some individuals, diaphragmatic breathing is automatically activated in this position. If not, we will consciously help the body achieve it. Why do we need proper diaphragm activation? Because the diaphragm not only plays the role of the main respiratory muscle in the body, but it is also part of a functional unit that provides torso stabilization. Torso stabilization is a requirement of every physical activity. It stabilizes and protects not only the spine, but also the other segments of the body. The way we breathe and our posture is always interconnected. A change in breathing can affect our posture and vice versa. When we change our posture, our breathing also changes. You will work with these experiences and think about them at the same time, the right position and the right breath. Come and see what the diaphragm actually looks like and how it works. Watch the animation carefully. This is your diaphragm, a domed muscle inside your body that separates the chest from your abdomen. With each breath, it descends and flattens. The other muscles of the torso and pelvic floor then react to this motion, expanding in an ideal situation. Our trunk slightly extends in all directions, forward, sideways, backwards, 360 degrees around. You may notice that when the diaphragm and other torso muscles are properly activated, a so-called cylinder is created from the center of our body. The lower ribs are immersed in the muscle, the abdomen is evenly tightened, and has a round shape. Nowhere do we see depressions or excessive tightening of one muscle at the expense of another, or protruding ribs. The slight expansion of the muscles in the abdomen is visible and noticeable. It is important to realize that a similar expansion occurs in the chest. It's not as visible, but with each breath, spaces between your ribs open up. Don't forget this detail during exercise. You can imagine the subtle opening of the spaces between your ribs and thus better induce it. Intra-abdominal pressure needs to be activated to properly strengthen the torso. You can think of intra-abdominal pressure as the blue mechanical model on the right. In the first situation, the diaphragm breathes freely, moving from one yellow line to the other yellow line. With inhalation, it moves down. With exhalation, it returns to the starting position. This happens, for example, when we are standing, sitting, or lying down. However, if we decide to make a movement, stabilization must be activated. The trunk must be strengthened. The degree of tightening is always proportional to the intensity of the movement. In this situation, The diaphragm and intra-abdominal pressure then looks as follows. With the need for reinforcement, the diaphragm flattens again to increase the intra-abdominal pressure, but does not return to its original position. It moves a little lower. This helps to create the desired firming in the torso, but at the same time allows it to continue its basic activity, which is breathing. You will train this effect in all of the following exercises. To be able to adequately strengthen the torso, we will call it creating the cylinder, breathe regularly with the correct engagement of the diaphragm in various positions and movements. So, you already know that during exercise you will pay attention to the correct positions of the torso segments as blocks above each other and the activation of the diaphragm while breathing. We have one more important principle that will allow you to better create and maintain a properly activated cylinder: activation from supports. You will have specific support points in all exercises. Pressing into the pad from these locations will facilitate diaphragm activation and overall stabilization. Finally, take a look at the different variants of each exercise position you will learn. Basic DNS exercises are inspired by the development of babies in the first year of life. This picture will show you at what age a child can handle a certain position. We will return to these skills through retraining. Training the correct breathing stereotype. Lie on your back, bend your legs. If you already feel that the head is in an unpleasant position, support it slightly. Just lay down for a while, breathe freely, try to relax as much as possible. Put your hands on your pelvis. Now lower your pelvis. Push your lower back into the mat. Your pelvis will tilt back. Now go in the opposite direction, tilting the pelvis slowly forward to gradually create an arch in your lumbar spine. And now the opposite movement again. Pelvis back and then forward again. It is important to perform the movements very gently, without pain, and with minimal engagement of the abdominal muscles and complete exclusion of the gluteal muscles. The movements are really smooth. The aim is to demonstrate the two extreme positions of the pelvis forward and backward, so that you are now able to recognize the middle position, the so-called neutral position. Now your pelvis is placed in the center of the sacrum, when the back is neither too arched nor too pressed against the mat. Another way to place the pelvis in the correct position is to sit on the ground, pull your knees to your body, and now place each vertebrae on the mat until you lie on your back. Release the abdominal wall. Your pelvis should be placed in the correct position. If you can't make a smooth movement, try a variant where you only grab one knee and the other leg stretches. Alternatively, try a variant in which you place yourself in the position via a careful cradle. Your pelvis is set, the lumbar muscles are in a desired pleasant stretch. And now we need to connect the chest with the pelvis. The most common situation is that our chest is set too high. We can feel the lower ribs protrude, and we still have a smaller or larger arch in the lumbar spine. The goal is to place the chest above the pelvis so that the lower ribs sink into the abdominal wall muscle, and the back muscles to be in contact with the pad. But nothing should be exaggerated. Be careful not to push your lower back too hard into the mat. When the chest is well positioned, the lower back automatically contacts the pad. If not right away, then later with better breath activation. We will now do a chest setting exercise. Place one hand on the sternum and the other on the lower ribs. With a breath, lift your chest up to your chin, inhale under the collarbone, open all the intercostal spaces properly, pause for a while, and now with exhalation, the chest gradually lowers, the sternum moves away from the chin, your hands fall until the chest reaches the exhalation position. Lower ribs immersed in the abdomen. Learn to perform this movement gently again. At the end of exhalation, it is necessary to activate the abdominal muscles. It's only natural that you may not be able to settle your chest completely at first, but that doesn't matter. Everything is a process. Gradually, with regular exercise, your shortened tissues will become more flexible and the movement will be easier to perform. As the chest settles, the pelvis maintains its central neutral position. The most common mistake is too much dorsal tilting of the pelvis. If your pelvis is tilting, try to figure out a way to prevent it. You have to practice it. Tip: don't force it. More often than not, it will help to become aware of the support point, in this case, the scapula and the sacrum, and try to maintain it, and at the same time, reduce overall muscle activity. So we have set the pelvis and the chest, and we check that the head is not in an extended position. If your chin is pushing too hard into your throat, release it. We can now move on to the basic activation of the diaphragm. If you remember the animation, it was clear that as the diaphragm descends into the abdomen when inhaled, the ribs seem to be open on the side and back. We want to achieve the same effect in the position when lying on your back. How to do it? I will offer two basic options. Place your hands on the sides of your lower ribs, gently pressing them towards the spine. Now breathe against your hands. You should feel your ribs pressing against them. With exhalation, the ribs return slightly toward the spine. Try again several times. Don't push with force, rather try to figure out a way to breathe under your hands. Oftentimes, it is enough to focus your attention under your hands and the breath will automatically appear there. Now try pushing your thumbs more into the back of your lower ribs, and now focus your breath under your thumbs. With a touch, you can now feel the ribs expand not only on the side, but also to the back. When you manage to properly activate the diaphragm by gently opening the ribs to the side and back, the breath continues along the spine to the area below your groin. You can also help with guiding your breath down to your groin by contacting your hands. Now place your fingers over your groin, inhale gently below them. The second variant is that the thumb touches the lower ribs and the other fingers touch the groin. Here, you feel the ribs opening to the side against the thumbs and then filling the abdominal wall under the fingers above the groin. Now we will repeat the whole process. First, take the breath under your fingers on the ribs to the side and back. The breath continues along the spine to the area above the groin, where you feel a gentle expansion under your fingers. With exhalation, the abdominal wall relaxes. During the whole process of breathing, the chest remains connected to the pelvis. It must not rise all the way up, you only feel how it expands slightly. With this exercise, you have taken the first step in training the correct breathing pattern. For the next exercise, which will be more demanding, we will also need to strengthen the torso to activate the trunk stabilization. The procedure will be very similar. The same starting position, the chest is connected with the pelvis. Inhale wide and back into the area of the lower ribs. The breath continues along the spine until you gently push against your fingers, which are positioned above the groin. Now with exhalation, you do not let go of the tension completely. Even with exhalation, the fingers remain gently pressed out. In this way of breathing, where the torso is slightly strengthened and ensured by adequate activation of intra-abdominal pressure, you are ready to lift one leg above the mat. Your thigh, along with your torso, forms an angle of approximately 90 degrees or even sharper, with the heel being higher than the knee. During the movement, even with the leg raised, you do not lose the gentle strengthening of the torso. You must not arch your back. Also, check that your head remains in the position of your spine. It must not tilt back. Now, add the other leg to the same position. Hold on a second. Breathe. Be aware that the area under the lower ribs stays in contact with the pad thanks to your breath. Feel the support of the center of the sacrum and the inner sides of the shoulder blades. The shoulder blades are wide set on the chest. For a better feeling, try a position where you join hands and place them on your forehead. The elbows point to the knees. Now you have the opportunity to feel even better support on the shoulder blades. Awareness and gentle pressure to the support points give the body a signal to activate stabilization. Another way to hold your hands is to put them in front of you as if you were holding a large gym ball. If the previous variant is still too demanding for you, which means that you cannot keep the chest connected with the pelvis when lifting the lower limbs from the mat and arch in the back or feel pain, try an easier exercise by placing your heels on a big gym ball in the starting position with your thighs and your torso at a right angle. Adjust the correct position of the pelvis and chest. With a breath, expand the ribs to the side and back. The breath continues along the spine to the area above the groin. Your fingers will be gently pushed out from the belly. You do not leave this activation completely even when you exhale. You continue to breathe and lift one foot off the gym ball, set down, lift the other foot, set down, and repeat. Choose a variant of the position of the upper limbs as you were most comfortable and you felt that you could best activate the cylinder. Along the body, folded hands on your forehead or hands in front of your body as if holding a large gym ball. If you manage to keep your back straight without arching, try to lift both legs from the ball for a while and continue breathing. Ideally, your goal is to train such a quality of torso stabilization that your torso can ensure the correct position of your spine, head, chest, and pelvis, and will not deviate when lifting or moving your limbs. When lifting your lower limbs off the mat or ball, watch out for the most common mistakes that occur. This is an arching of the lower back when one or both lower limbs are lifted, or conversely, excessive dorsal pelvic tilting. Both variants are accompanied by the shoulders pushing forward and tilting the head back. You have already practiced how to set your head, chest, and pelvis correctly, how to strengthen your torso, and raise your legs above the mat. I would like to remind you that we call this position on the back the 3-month-old because a healthy baby spontaneously assumes this position at that age. So, your first task may be to stay in this position for a while. Breathe regularly. Notice the support from your shoulder blades and sacrum. Gradually, you will feel that you can stay in this position longer with less effort and a greater feeling of comfort. After mastering the basic 3-month position, You can start practicing variants of the exercises on your back. In the starting position, add ankle circles in both directions. Your torso remains firm without deviation, and you breathe regularly. Relax. Now, try to make circles with your hip joints. Imagine a pencil running from your knee to the ceiling, and as if you want to draw circles on the ceiling with your knees. You can gradually try to increase the range of motion, but always make sure that you can maintain the correct adjustment of your head without extending and without your back arching. Relax. Try wrist circles. Relax as needed between exercises. Another option is alternating lifting and laying of your lower limbs. Gradually, you can try to stretch the lower limbs farther into the distance, always keeping form without arching your back. Lifting your upper limbs behind your head can be a great exercise. Raise your arms only to the extent that you feel that you will keep your chest connected above your pelvis, that it will not be pulled up, and that you will not arch your back. You can also put your upper limbs behind your head, alternating between them. Finally, try a more coordination-intensive exercise, stretching your right arm and left leg in opposite directions and then alternate. A popular tool for exercise is a gym ball, with which we will also show you several variants. This will make the exercises more varied. The starting position is completely preserved. You just insert a gym ball between your knees and hands. Now try pushing the ball with your right hand and left knee. Without deviation in the torso, you will feel greater activation of your abdominal muscle and reset. Now push with your left hand and your right knee. Don't forget to breathe. Repeat several times, then rest. In the next exercise, stretch your right arm and left leg and alternate. Now, just grab the ball in your hands and throw it up. Try passing the ball between your toes and your hands. Another popular exercise is chicken on the grill. You strengthen your torso, breathe, and only as a whole, you roll slightly to the right, then to the left. Your line of sight and the rotation of your head begins to move. Your torso immediately follows. It is important to keep the connection between your chest and your pelvis, activating your cylinder. You want to train to make the movement slowly and smoothly, and stop when you see fit such that you won't fail. The circus bear requires the most coordination, where you try to move the ball above you by moving your limbs. If you have a Thera Band or any other elastic rubber for exercise at home, you can try these variants. Thread the rubber under your knees, then guide it in front of your body, where you will cross it. Put the rubber in your palms, strengthen the cylinder, then lift your legs from the pad. Then wrap the straps in your palms so that your fingers can remain free and open. Now lift one hand behind your head, then put it back. Put your other hand behind your head and then put it back. Now stretch both hands at the same time. Feel the firming of the torso. Do not arch your back and breathe. Another option is to alternately stretch only the lower limbs, or alternately stretching the right hand and left leg and vice versa. Or even stretching all 4 limbs at once. Always pay particular attention to the correct quality of the movement. You can also use a small ball to diversify and pass it between your lower limbs. You can come up with more complex variants, but be careful not to overdo it. Lie on your stomach, resting your head on your forehead. Pull your hands into the support position so that your elbows are in line with your ears, with your palms lying flat and converging slightly. Understand how the body is positioned. Most often, the lumbar spine is too arched and you can feel the load on your lower ribs. We will learn to improve this. The aim is to change the position of your pelvis so that the lumbar extension is leveled and support is transferred from the rib area to the pubic bone. Now I will offer you 2 different instructions according to which you should be able to handle the movement over time. Imagine that you want to slightly support your pelvis and pull the tailbone towards your heels. Do not strain the buttock muscles or hamstrings. Relax. Repeat this pelvic movement several times to gain confidence in it. If you are not successful, or you do not know how to move the pelvis, try another option. Now imagine that you want to pull the lumbar spine slightly upwards towards the ceiling, directing your breath to the lower abdomen. This will help you support the spine. Repeat this movement several times. Now transfer your attention to the area of your upper limbs and shoulders. Here, we want to create the right support for the elbows, where the shoulder blades will be placed in the right position. From the starting position, pull your shoulders up to your ears with your exhale slightly down and wide. As soon as you place your shoulder blades down and wide on your back, your elbows will automatically be supported. Repeat several times. Try to feel your collarbones expanding and the upper arms as if gently turning them outwards. Now keep the support on the elbows and, if necessary, add the movement of the pelvis towards the heels to get into the support position on the pubic bone. Perceive these 3 support points and breathe down towards the abdomen and pelvis. You can feel that a slightly reinforced cylinder has formed from your torso again. Keep breathing, and now you can add the movement of your spine pulling out of the area between your shoulder blades into the distance. Your forehead is slightly lifted from the pad. Be careful, the shoulders remain in a position away from the ears. You do not want to feel that the tension in your neck muscles is increasing. On the contrary, this exercise should bring them relief. The spine must not be arched, and you should not lose support from the pubic bone. Even those who practice regularly recognize that this position can be quite demanding. Kneel on all fours into the support of your hands and knees. Place your palms approximately shoulder width apart, perpendicular to your shoulders. If the position is painful or uncomfortable for your wrist, move your hands slightly forward. The knees are placed approximately the width of the palms, perpendicular to your hips. Your lower legs and insteps lie loosely on the mat, with your feet coming together slightly. If it were the other way around, it would support the shape of the lower limbs to an X, and we really don't want that. If you have a small gap under the insteps, it does not matter. It will be adjusted immediately or over time during the exercise. But be aware, the position should not hurt you. If you experience severe pain, cover your insteps with a rolled up towel or rest your feet on your toes. We have a rough layout. Now we will edit the details. First, adjust the hand support. Spread your fingers apart with your middle finger facing forward. Feel the even support of the whole hand, including the fingers. The most common mistake is that the fingers remain crouched and that support is lost from the thumb and is only held on the little finger side of the hand. Rest your shoulders down, wide away from your ears as if you want to extend your collarbones. We say keep the shoulders open. It is helpful to have the idea that someone is rotating your arms outward. It will help if you pull your shoulders up towards your ears to realize the wrong position and then gently pull them downward to the correct position. Repeat this exercise several times. Possible mistakes when adjusting the correct position of the shoulders is that the shoulders remain at the top of the ears and the shoulder blades are pushed too close together. When you open the shoulders, the palm resting position does not change. It remains evenly distributed, the fingers are stretched and in contact with the pad, and the elbow holes point to the space between the thumb and the second finger. The elbow remains in position outstretched. They must not be too extended in the so-called hyperextension, but not too bent either. Now, notice the support created on the palms and on the knees and lower legs, and this often adjusts the position of the spine towards straightening. If not, we'll make it better now. So, what should a straight, or more precisely, uprighted spine look like? Surely everyone knows when the spine is too arched or too bent. It's good to try these two extremes on yourself and then find the right center. Pretty straightforward. The first exercise, take a deep breath, bend the spine as far as possible, pulling the shoulders to the ears. And now on the exhale, move your shoulders slowly down from your ears and gradually get through the middle position of the spine until the extension. As you arch, feel at the same time that you are pulling your spine from your head at the front and from your tailbone at the back. Move smoothly and gently. And now again, slowly bend your spine at inhale and add a feeling of stretching from your head and tailbone and exhale through the arch. Also, try the variant where you slouch with the exhale and arch with the inhale. The second exercise will be similar. Inhale, slouch your back, and now on your exhale, straighten your spine and try to stop where you think your back is straight. The back is straight, or the spine is uprighted, if you do not see any dips or arches. When you activate the cylinder diaphragmatic breathing, in this position, you will see that the ribs are beautifully immersed in the abdominal wall and do not protrude forward. The abdominal wall has a round shape, and the indentations under the lower ribs and groin fill in. These are details that, by looking in the mirror or perceiving your own body, will tell you that you are in the right position. You have set a basic position, so we can move on to a more dynamic exercise. From the starting position, you will retract your torso towards your heels, but you want to keep your spine straight. So the instruction is, sit back on your heels, but only as long as you can keep your back straight. Here, it is absolutely necessary to activate the cylinder to keep your spine uprighted and allow smooth movement without deflection. Keep your shoulders away from your ears and maintain even support on your palms throughout the movement. When sitting backwards, make sure that your lumbar spine does not bend and conversely, that your upper spine straightens sufficiently. You can stay in the end position for a while, breathe, and move forward again. The most common mistakes are slouching when moving backwards and arching your back when moving forward. Another exercise is to move forward from kneeling on the heels. The starting position is in a heel sit with your back straight. Imagine you want to move forward, but someone is holding your pelvis. So, you can't move from your place, but your body is activated and your spine straightens. How does that feel? Pushing down on your lower legs, activating the cylinder, the abdomen begins to rest on your thighs with each breath. Your spine is pulled away from your head into the distance, while your shoulders settle down wide on your back. Once you have activated, you can complete the move to the starting position on all fours. Now, continue to move back and forth in your rhythm, learning to move your reinforced cylinder above the limbs. Relax. Sit on your heels, relax your back into a slouching position. Breathe. Another variant of the exercise on all fours can be the activation of the cylinder through increased pressures of the limbs on the supporting points. Align in the starting position. Now you just push your right hand, left knee, and your whole shin into the pad. You should feel your body strengthen, and as the cylinder activates, you breathe down into your pelvis. Then, push the opposite limbs. When pressing into your limbs, your body must not be tilted to the side in a bow, slouch, or in any other way. Lastly, try a more demanding exercise where you feel the support of your left hand and right leg. You will strengthen and stretch the opposing limbs, that is, your right arm and left leg. Then alternate, again without releasing your cylinder. This position is called 6-month-old because a healthy baby at this age spontaneously assumes a similar body position. The starting position is in a kneeling position on all fours. Move both of your palms forward, gradually move your weight forward. Your pelvis drops until it reaches a position where your torso and thighs are in a line. This is already a very challenging position. Be conscious that your fingers are outstretched, you maintain even support on your palms, and that your shoulders are downward from your ears. Your chest should not fall between your shoulder blades and should not be too slouched. The lumbar spine must not be arched either. Imagine tilting your pelvis so that the pubic bone pulls up to the navel and your tailbone pulls back to the heels. Your buttock muscles are not tightened. Hold for a moment and breathe. Now, back up with your back straight so your sciatic bones do not sit on your heels but point slightly upwards so that this time your arms and torso get in line. Then, transfer the weight of your body forward again into the 6-month, i.e. to the support of your palms and knees. Repeat the forward and backward movements several times. During the whole exercise, try to keep your chest connected to your pelvis secured by activating the cylinder, shoulders away from the ears, and a straight spine. Now, try the variant where you lean on the tips of the toes in the 6-month position. Lift your knees and get to the plank position. Watch your straight back. The tailbone extends backwards towards the heels. The pubic bone seems to be attracted to the navel. Do not slouch the thoracic spine. You can include the plank position in the sequence. Lift your buttocks back, obliquely up to the ceiling, and bend your knees until you reach the bear position. From the bear to the plank, from the plank to the support of the palms and knees, and from this position, release into a heel sitting position. The most common mistakes are excessive flexion in the hips when moving forward, or that the pelvis remains too tilted forward. A frequent shortcoming is slouching in the chest or losing good positioning of your hands and shoulder blades. Can't control your pelvis and change its incorrect position? Return to practicing exercises with the pelvis in the 3-month prone position. Align yourself in the starting kneeling position on all fours, lean on the tips of your toes, also support your hands, activate the cylinder, lift your knees off the mat, and raise your whole torso with a straight spine. Initially, a few centimeters above the pad is enough. The goal is to maintain a stable position without bending or arching in your back, with your knees being held slightly apart. The shoulders are away from your ears, and the even support on your hands is not lost. We also want to keep even support on the front of your foot. One mistake would be to overload the toe and to drop the arch of the foot inwards, which is often associated with the knees escaping inward, or the opposite situation, excessive support on the toe edge with omission of the support from the big toe. Another mistake is bending your lumbar spine when lifting, or, on the contrary, arching the whole spine. Tilting your head should not happen in this exercise either. When exercising, hold in the raised position for a while, breathe, then place your knees on the mat again. Repeat the exercise several times. To make the exercise easier to manage, it pays to prepare. Kneel on all fours again, lean on your toes, and move your torso back, keeping your back straight. Then, forward again. Repeat several times. This is a variant of the rocking exercise that you already know. This will stretch your toes and muscles of your feet and make you more aware of the support. And you are gradually preparing for more demanding variants of the bear. When you have mastered the basic lifting, try the variant where the pelvis will gradually rise more up and back. Push yourself backwards from your upper limbs. Your back must remain straight, with your shoulders away from your ears. In this exercise, you should feel the back of your thighs stretching. Stay in this position for a while. Breathe. Then go back to kneeling on all fours and relax in a heel sitting position. When you have mastered the basic position of the bear, lift one foot off the mat. Put your foot down and raise the other. It is important that neither the pelvis nor the body should deviate from position when lifting each foot. If you are not doing well with your head positioned downwards, or if you want to reduce the load on your upper limbs, or you do not have the opportunity to exercise on the ground, a variant of a bear with a chair support will be suitable for you. Stand in front of the chair, place your legs approximately shoulder width apart, and squat slightly. Stretch your upper limbs in front of you and lean with your hands on the chair. Make sure your knees do not go over your toes. Straighten your back. Feel the connection of the chest with the pelvis and the activation of your cylinder. This time, you are not on tiptoes, but your heels are on the ground. Now, imagine that you want to pull your buttocks up to the ceiling. You should feel your hamstrings begin to stretch. Sit back slightly in a squat position where the tension on the back of your thigh will release. Then, again with your head forward and your buttocks up to the ceiling. You may notice that your knees are more straightened and that you need to bend your elbows slightly to ensure a straight spine and torso position. Stretch your legs only as long as you can keep your back straight. The most common mistake is slouching. You can use the same exercises as you did with the chair support and the table support. The difference will be that when you try to pull your buttocks higher towards the ceiling, your torso tilts more towards the table, and you gradually get into the support of your forearms. Try the squat transition from the chair or table support variant. Put your pelvis down and back, lean into both feet for support, then lift your hands away from the chair or table until you reach a squat position. Your torso now moves into a parallel position with your lower legs, and your knees should not move in front of your toes. Hold for a while, breathe, and stand up. Repeat the exercises several times. Sit on the edge of a table or raise the position of a chair so that the angle between your torso and thighs is more than 90 degrees. Correct the position of your limbs. Push your heels back slightly, but your knees must not move past the line of your tiptoes. Keep your knees slightly apart. Your feet should be set in the thigh line. Feel the even 3-point foot support. Under your heel, in the area of the joint under your little toe and under your big toe. Your lower limbs are level. Now you need to settle your pelvis and chest in the correct position. Your pelvis is not tilted too far forward or backward. It is positioned straight up directly on the sitting bones. Keep your chest directly above your pelvis. The idea is that you are pulling your head from the area between the shoulder blades up to the ceiling. Keeping your tailbone stretching down into the chair or table will help. You should feel your core cylinder activate. Breathe. Put your hands on your pelvis, and now your pelvis will lean slightly forward with your whole torso. As you lean forward, you should gradually feel more strain on your legs. Keep your back straight. The most common mistakes are slouching and insufficient movement of the pelvis, or, conversely, excessive tilting of the pelvis forward and arching in the back. Repeat the torso exercise in a half-seat position several times during the day. Exercise is not about strength, but about coordination. You have to figure out the right way and then practice it regularly. Lean your straight, reinforced torso forward with your feet on the ground as if you were about to get up. Your head points diagonally towards the ceiling, with your tailbone pointing down towards the chair or table. Feel your breathing directed to your pelvis and slightly expand the entire cylinder. Then, lift your pelvis from the table, sit down, and in the next attempt, lift your pelvis and stand up with your back straight. Then, sit back and repeat the exercise. Stand at arm's length from a chair, feet shoulder width apart, resting your hands on the backrest and sitting slightly back. At the same time, keep your body straight and firm as it leans slightly forward. Pull out of the squat position again to stand up. The important principles for half squatting or subsequent squatting are that you start your movement by sitting the pelvis backwards, your knees slightly turned outward, and your thighs remain in the line with your feet. Your pelvis tilts over your thighs, your chest remains in contact with the pelvis, your spine straight, and head as an extension of your spine. Keep your shoulders loose, set wide on the chest at the bottom. The most common errors occur in the lower limbs, where the knees converge, which is often associated with the collapse of the arch of the foot. In the area of the torso, it is often a mistake to bend the spine, or conversely, tilt the pelvis too far forward and arching in the lumbar spine. When you have confidence in the movement, you can finally try squatting with your hands on your pelvis or in front of your body. Lay on your side, position your limbs at right angles to your body. Straighten your back and place your upper hand on your side. Your head should be supported by a towel or cushion so that it is in line with your spine. Activate your cylinder in diaphragmatic breathing, and the task will now be to roll your torso as one unit backwards. Don't forget your head, which, along with your line of sight, rotates with your body. The tilt backwards is slight, approximately 45 degrees. You can also put your upper arm in position in front of your body. The important thing is that when you deviate, your bottom arm and leg must not come off the mat. They are your support points, your back remains straight, and you feel the necessary activation of your cylinder. You can feel under your fingers that the space above your groin is filled. Repeat several times, breathing freely throughout the exercise. Sit on your right side. Bottom thigh, including your knee, is perpendicular to you. Place your open palm in line with your side. You can now feel support on the right side and thigh and on the palm. Straighten your back. Place your chest over your pelvis again like two blocks on top of each other. Check that the lumbar spine is not arched. If so, tilt your pelvis slightly backward. Sometimes it helps to be conscious of the correct position in case we collapse into the wrong one. Now, try to bend your side toward the mat. Pull your shoulders up to your ears. And now, move your shoulders away from your ears, lean into your lower thigh, and pull the side of your body into a straight line. Now, raise your left hand up toward the ceiling. Push yourself away from your bottom arm as if you wanted to have the widest possible arm span. Your shoulders are set wide down on your back. You may feel that your neck has stretched. Inhale, exhale with your left hand on the pelvis and turn it along with your entire torso diagonally forward. Now, your left hand stretches along with your torso. During the movement, you can keep the connection of your chest with your pelvis, the cylinder, and you breathe. Do not arch your back. Keep your shoulders away from your ears. Breathe all the way down to your pelvis. Ideally, you should feel the bottom of your buttocks stretching. You definitely don't want to feel pain in your groin. If so, check your position. And repeat. Inhale, raise your left arm up to the ceiling. Pay attention to the position of your torso, keeping the cylinder and that your shoulders are away from the ears. Exhale. Turn straight behind following your left hand diagonally forward. When in the final position, stay in this position for a while. Feel the elongation of your spine down towards your tailbone and down to the mat, with your head in line with your spine. Breathe freely. Now, push from the starting position into your supporting thigh, strengthen your torso, and remove your bottom arm from the pad. Repeat several times, and then you can try the transition to a free sitting position. The most common mistakes during this exercise are the disconnection of the chest and pelvis. When the lumbar spine arches, this often includes the so-called shoulder suspension, when the shoulder is too lifted towards the ear and the hand does not maintain even support. Such a position can already be observed in the starting position or later during the movement. We also consider the opposite situation to be a mistake, when the spine falls into the slouching position. Sit on the mat, bend your legs, palms in contact with your knees. Now, bend as much as possible with an inhale. Pull your shoulders up towards your ears. Hold your upper limbs lightly, breathe for a while, and then, with your exhale, pull your shoulders away from your ears and gradually straighten your spine. Repeat several times. Once you find the right support for the center of your buttocks, you will feel that your spine is straight and you have an activated cylinder. Now, it should not be a problem to lift your hands in front of your body. Alternatively, you may descend with your entire torso slightly back and forth, or add arm movement to the uplift. You can include free sitting exercises in the sequence of your transition from oblique sitting from one side to the other. Make sure that your back remains straight and that your pelvis does not fall into tucked position. From the starting position, kneeling on all fours, slide your right foot forward into foot support position. Your heel should be perpendicular to your knee. Your lower left leg is supported by your knee and entire shin, which converges slightly to the center. Your instep lies loosely on the mat. Next, align the thigh of your front leg so that it is slightly turned away from your body. Your foot is placed in the continuation of your thigh line. Keep your fingers spread apart and think again about the even support from your whole palm. Shoulders down wide from your ears, and try to straighten your spine as far as it will go. Most often, you feel sensation and stretching around your right leg or in your spine. From the starting position, rotate your right arm toward the ceiling. Shoulders away from your ears, with your shoulder blades wide apart as if you want to relieve yourself from your bottom arm. Breathe freely. Feel your spine straightening, along with the necessary activation of your cylinder. Put your right hand back. Now, move your weight slightly forward. The next step is to lean on your toes and lift your knee. The hand on the side of your foot, which is in a support position, turns upward to the ceiling again. Keep your shoulders away from your ears, keeping your front leg position. Move your right leg 1 to 2 feet forward, arms also forward. Always try to keep your back straight. Carry your weight forward and feel the stretching on the front of your left hip joint and groin, and breathe. Now, back up. Imagine that you are extending your right hip and feel the stretching of the back of your right thigh this time. In the back position, your back is often slightly slouched, but it doesn't matter. Then, continue forward again. You ideally end up in a position where the torso and hind leg are in one line. But everyone follows their current possible range. You should only feel a slight pull, not pain. The knee of your front foot must never pass in front of your toes. Align in the starting position. Push down with both lower limbs, strengthen your cylinder, gradually lift your hands from the ground, and raise your straight torso to the position of high kneeling. Come back. Repeat this exercise several times, and don't forget to switch legs. Remembering that a firm torso revolves around the hip joints will help you with this exercise. In the final position, your torso and thigh form one line. If you are unable to straighten your spine in the tripod position, your back is still too slouched, or you have an unpleasant feeling in your hip area, choose a modification using a raised hand support. At this point, the position should become more pleasant, but still active. After activating in the basic position, rotate your arm again toward the ceiling. Then, try turning with your back knee raised from the mat. Stretching your hips. And finally, transition to high kneeling. You can get to the high kneeling position from the tripod. Kneel on all fours, slide one leg forward into the foot support position. Straighten your back as far as it goes. Press into the support of both legs, activate your cylinder, relieve your arms, and raise your straightened torso to an upright position. What should the correct position in a high kneel look like? When viewed from the front, adjust your position so that the supporting knee is directly under your hip. The torso and thigh form one line. The defect is usually when the knee falls too far under the body and the hip shifts to one side. The front thigh is slightly turned outward, and the line of the foot is in the continuation of the thigh line. The height of the hips remain the same. When viewed from the side, it is important to look at the position of the pelvis and spine. Ideally, the back and thigh form one line. The most common mistake is to tilt the pelvis too far forward and arching the back. If your back is arched, change the position of your pelvis by imagining that you are pulling the pubic bone towards your navel and the coccyx pulled down towards the mat. Then, release back to arching. Repeat this movement several times until you are sure. You can perform the same exercises with the support of your upper limbs on a ball. From the high kneeling starting position with support from your upper limbs on a ball, move your front leg approximately the length of your foot or more forward, and gradually shift your weight forward. Your body with your hind leg should form a straight line again. Above all, make sure that the position of the pelvis is not arched. Switch legs and repeat several times. This exercise can be performed without a ball, or add the movement of your arm raising upward.